anybody's ever had a toothache, it's the worst pain, and mine had blew up, and my whole face had blew up too. So it was like the tooth had taken over my whole body, and you know that pain right there caused a whole pain in my whole face, whole body ache, throbbing. This is the worst pain ever, man. Please, somebody save me. And to the rescue, Dr. Short came.
I just want to be able to do the best I can and be the best at what I do.
I always hear about pain. I didn't even have any pain dealing with Dr. Short.
My concerns about getting a root canal before Thanksgiving was that I would not be able to enjoy my dinner that we'd had planned for the whole family, but that was no problem whatsoever.
He talks you through it. I've never really been apprehensive about local anesthetics. I've given enough myself, but I was comfortable during the procedure.
And basically it boils down to the golden rule. You treat people how you want to be treated. And me, as being a patient, I would want to be well informed on what I'm getting and why I'm getting it. Some of the people that came through the office, entertainers, artists, comedians, choreographers, and to be able to take care of them in a painless way is critical, because these guys are on national TV. They are doing huge concerts. So the last thing they need is a tooth problem that can prevent them from being able to perform.
I go to this doctor, and I'm thinking that, you know, he's really gonna help me. He looks at my tooth and he says, man, you need to just pull a tooth. I say, you know what? I don't really want to pull my tooth. So I got in my car immediately and left this dentist, and I went to to his office, and I went in and he looked at my tooth and he was like, man, you don't need to pull your tooth, man. You good. You know what I'm saying? I can fix this. And you know, I was like, for real? Because everybody else had told me I needed to pull the tooth. And he told me, man, I got you, man, for real. He showed me, he printed it out. He had the screen, he had the flat screens and all this stuff. And he showed me what was wrong with my tooth. And he fixed it. He just did some things that, you know, the other doctors couldn't do.
The experience I had at Dr. Short's office, just from walking in the door, his office was very inviting, very comfortable and relaxing. And whenever I was in the chair, he just made me feel very comfortable. You can tell he's passionate about his work. Me being able to watch TV was a plus, always. And yeah, just the whole time I just felt relaxed.
My relationship to the general dentist is basically an extension to make sure their patients are receiving the optimum level of dental care.
He actually practiced general dentistry coming out. So the ability to have a specialist that understands the role of the general dentist, I think that helps in the way you treat patients. They see things from a general dentist perspective. There are times when we've worked on cases together and he's mentioned, well, you might want to check this, or you might want to do this. From a general dentist perspective, not from an endodontic perspective, that's helped me become like a better dentist. The way we practice now, the patients are getting a much better dental experience than, say, you know, one person trying to do everything. You can't be perfect at it all.
Technically and skillfully is very good at what he does. He even, you know, with the general dentist, he'll send us emails of radiographs not attached to a patient's name, but just say, what do you think's going on here? Or look what we were able to accomplish. And it's just like some of the most complex things you've ever seen that really, without, you know, the great equipment that he has and the skill that he has, it's just not possible to do.
The operating microscope, to the surgeon, it has been a tremendous advance for the reasons I've said, that you operate in a smaller field, less trauma to the tissue, oftentimes a quicker procedure, and this is one of the things he does.
What I liked the best, I think, was that when he finished a case, he followed up on it, and if the patient had any sort of discomforts or any minor things, he would follow up on it until they were completely satisfied.
On average, when I actually come down to treat patients, we see anywhere between 8 to 10 patients, and each patient may need anywhere from 1 tooth to 4 teeth extracted at one time. There are some days that I actually teach the dental students, and it's actually a full day that we actually teach them. But it's always rewarding. Alrighty, getting ready for war here. The good war, that is. We're fighting the war of tooth decay. And let's go and see what we got. The issue is inside. Experience is something that money can't buy. Just the experience to be able to touch someone who's been hurting and they can't afford any treatment, and to be able to turn their life around within a matter of hours by taking care of something that's been hurting them is phenomenal.
You got it. Thank you.
I just think he's made a real difference to our profession, as well as, to our community.
One who's inspiring through his works, teaching people not just only the field that what he's in, but just morals and just how to be a man.
I always recommend Dr. Short because I know that, he can get the job done. He really got in there and he really kind of did some things. Now I have a bionic tooth now, thanks to Dr. Short. Bionic. So this tooth right here might got some wings on it and it might take off and fly one day. Dr. Short did it. So go see him.